Welcome to the Canadian Medical Association's 2026 Annual General Meeting. My name is Dr. Melanie Béchard, and I am the AGM Chair. Dr. Carl White-Ulis has been appointed by the CMA Board to serve as the interim AGM Vice Chair owing to a vacancy. I would like to note that off-screen, Mr. Dave Bennett, a parliamentarian and meeting support specialist, will help advise on the conduct of the meeting. We currently have 76 members online for today's meeting. The CMA bylaws establish quorum at 50 members, so we're ready to get started. I'm chairing this meeting from Ottawa, which is located on the never-surrendered homeland of the Anishinaabe Algonquin Nation, a land of spirit and purity, of healing plants and sacred waters, provided to the people by the Creator since time immemorial. With great humility, we offer gratitude for the commitment that the Anishinaabe Algonquin have always held in keeping the song of a healthy nation alive for all people of this beautiful land. We have a responsibility to understand the history of the land on which we live and to acknowledge the Indigenous peoples who have called this land home since time immemorial and who have had their systems and structures disrupted by colonialism. I invite each of you to take a moment to reflect on the territory where you are, either quietly to yourself or in the chat. Thank you for joining us today. As we work toward our shared goal of better health, healthcare, and a thriving health workforce, we look forward to updating you on our progress this past year and hearing your questions and feedback. If any members wish to provide their pronouns and salutation, I invite you to do so at the start of any text-based or verbal remarks during the meeting. If no preference has been stated, I'll refer to all participants using gender-neutral pronouns, unless I know you personally, and the prefix doctor. Now, Dr. White-Ulis will provide you with instructions on the event site and how to engage in the meeting.
Good day. A reminder that you should be joining us today using a computer or tablet. By doing so, you will be able to take advantage of the interactive features, including the Q&A, chat, verbal participation, and voting. As shown on the slide, the live stream window can be resized or repositioned as you wish. To increase the size of the text on your browser, simultaneously press the Control key and the plus key. If you are using a Mac, simultaneously press the Command key and the plus key. Closed captioning is available in both English and French based on the language chosen on the event site. If you have any technical question or problems with the event site, please click on Tech Support at the bottom of the navigation panel to the left of your screen. For non-substantive questions pertaining to the AGM, click on CMA Support at the bottom of the navigation panel. Staff will be available by email to assist you. CMA members will have access to various engagement features on the navigation panel, which are not available to observers. The chat function is available under the Engagement tab and will be open during the entire meeting. There is a 350-character limit, and comments will be published in the language they are submitted. Please note that the chat is monitored, comments are not anonymous, and all content will be downloaded following the AGM. Do not use the chat to request technical support or to submit substantive questions for AGM speakers. The text-based Q&A function is available under the Engagement tab. Members can type substantive questions in English or French throughout the meeting. We encourage you to use your preferred language. There is a 350-character limit in either language. Je veux aussi préciser que puisque je suis bilingue, je pourrai répondre aux questions.
Since I am bilingual, I can answer questions in either French or in English.
If you submit a question that is relevant to the report at hand, it will be published for upvoting. You can upvote questions you want answered using the thumbs up button. If you submit a general question that is not related to the report at hand, it will be published for upvoting during the final Q&A. I would like to highlight a few important points. We ask for a respectful tone framing your questions and comments. Questions that are discriminatory, defamatory, violent, harassing, or violate privacy will not be addressed and will be dismissed. If a member's verbal remarks or written comments in the Q&A or chat do not respect these guidelines, any other member has the right to call that individual out of order. This can be done through a procedural motion, which I will explain momentarily. Under the Engagement tab, you will see a drop-down menu with two options for motions, procedural motions and second motion. please do not test the buttons at this time. You will be able to use the procedural motions button during the meeting to request to verbally raise a point of order, point of privilege, or a secondary motion. When you click on this button, you will be redirected to Zoom, where you will receive further instructions from the AGM chair. Clicking on the button to second a motion will show the attendee's raised hand. Their name will then be communicated to the AGM chair. When a vote is called, a pop-up window will appear on your screen. Members can vote on motions during the AGM, but only General Council delegates can vote to approve the slate of leadership nominees during the Nominations Committee report at the end of the meeting. Once you cast your vote and hit submit, the vote will be counted as final. Those who are joining the meeting as observers have no voting privileges, but you will see the results displayed. Today's agenda is available at the top of the navigation panel. Please note that all times are approximate. We also have a resources tab where you can find the minutes from last year's AGM, documents related to each report for today's meeting, and the AGM handbook, which provides further instructions about the event site. I will now invite Dr. Bichard to explain the procedural and meeting management aspects of the AGM.
Thank you very much, Dr. White-Ulyss. I fully recognize that in an assembly, there are often diverse opinions on the issues to be voted on. My role is to focus entirely on the process, and I will not take any positions on the issues. There are 4 items for you to be aware of. First, a vote is required for the approval of the minutes from the 2025 Annual General Meeting, and it will be carried out by a voting method called unanimous consent. Here, I will simply ask if there's any objections, and if there's none, I will declare the minutes adopted by unanimous consent. A vote is also required for the appointment of the auditor, but the likelihood of debate does seem to be small. Accordingly, I'll pause briefly for any questions or dissent, and then take a vote by unanimous consent. My third comment is on whether any new business can be added to the agenda. In accordance with our bylaws and operating rules and procedures, motions at the AGM are encompassed by the corporate business proposal process, and the deadline for submitting corporate business proposals was 90 days before the AGM, and an update will be provided during the Governance Committee report. No new business or substantive motions may be brought forward from the mic at the AGM. My final comment is about points of order, which should only be used if you believe there is a violation or potential violation of the rules, an omission or error in procedure. We may be able to resolve the point informally and expeditiously, or we might need to pause the meeting briefly to confer about the procedural issue. The event site we are using today provides a secure, validating voting features that the CMA bylaws require for motions. I'm very excited. We will now do a test vote to ensure everyone is familiar with how the process works. You will soon see on the slide a test motion that chinchillas are the softest animals. This will be the hardest vote for me not to take a position on today. When the voting pop-up window appears on your screen, you will have 1 minute to vote. You can change your vote during that time, but once you hit the submit button, your vote will count as final. Please stand by while I check to make sure we're ready to launch that test vote. All right, we are ready. Please vote now. All right, the vote should be open. Again, if you are able to cast your vote in less than 1 minute, we applaud you on your technical aptitude, but we ask you to be patient so we can assist anyone who might be experiencing technical difficulties. There's about 30 seconds remaining. Seconds left. Please get those votes in. This is our chance to make sure the platform's working well for you. Okay, the voting period has ended. Please stand by while I check to ensure we have the results available. Okay, please display the results. When it comes to the motion, chinchillas are the softest animals, we have 66 for and 28 against. Ugh, it's just factually incorrect, but That's democracy. We'll let you have that one. More importantly, if you experienced any difficulties with the vote, please click on the text support button located in the lower left-hand corner, and then click on the Contact Encore support button in the middle of the screen. We will now proceed to the motion with respect to approval of the minutes from the 2025 AGM, which were shared with member participants via email and are currently available under the Resources tab. The mover of the motion is Dr. Andre Bernard. The seconder is Dr. Margot Burnell. The motion reads, the Canadian Medical Association approves the minutes of the 2025 Annual General Meeting. Again, this type of motion is usually not controversial. However, if there is any objection to this motion, click on that engagement tab and then select the Speak to a Motion button from the drop-down menu. This will allow you to indicate if you wish to speak verbally to the Assembly. So again, if we do not hear any dissent, the motion will be carried. But if there's any dissent, then we will go into a full vote. So please stand by as we check to see if there's any objections. Okay, I've been informed there's no objections. Since there are no objections, we will use a principle of unanimous consent under Robert's Rules of Order to pass the motion without debate and without voting directly on it. The motion is carried by unanimous consent. I will now call on Dr. White-Ulis to chair the next portion of the meeting.
Thank you, Dr. Bichard. We will now hear remarks from CMA leadership. I invite Dr. Andre Bernard, our new CMA board chair, and Alex Budter, our CEO, to present their annual report and provide an update on CMA strategy.
Hello, everyone. Bonjour à tous et à toutes. Thank you for joining us today. In delivering the annual report, I want to begin with something very clear. The CMA is renewing its commitment to you and the communities you serve, not through abstract aspirations, but through concrete actions grounded in the realities that you are facing right now, that our profession is facing right now. And the CMA Board of Directors reaffirms that the CMA is first and foremost a membership organization. Our purpose is to be your national voice, advocating on issues that affect your practice, your patients, and the future of our profession. Setting a clear strategy to strengthen health and healthcare in Canada, and bringing physicians together so your collective experiences and expertise can inform the way forward. Our credibility and influence as the national voice depend on being grounded in your lived experience. The stronger the connection to you, our members, the stronger our advocacy becomes. Physicians across the country have been telling us they have ideas, they have solutions, and they expect that their national association will listen and act. And we are doing exactly that. Through events like the President's Listening Tour and regional member forums and other channels like surveys, social media, one-on-one conversations, we're hearing directly from you. Those insights are shaping our priorities, our advocacy, and how we show up for you. We've also applied a membership lens to everything that we do. Dedicated teams are now focused on modernizing the member experience, building on the changes introduced last year to the membership terms. We're working to better articulate the value of CMA membership so you can more clearly see how we're supporting you across your career stages and practice settings. We've also created a new professional practice department to better support you in the realities of your day-to-day work. And we're beginning to see a momentum. And after a period of decline, the CMA membership has grown to more than 38,000 members. And our goal of reaching 40,000 members and beyond in 2026 is well within reach. All of this is happening in a world marked by pressure and uncertainty in healthcare and beyond. You know that, you experience it. When the CMA adopted its Impact 2040 strategy, we were in a very different moment. The pandemic was still shaping daily life. Healthcare was at the center of public and political attention. There were significant new federal investments and programs, from the health board to dental care and pharmacare. Today's reality looks very different. We're operating in a more complex political and fiscal environment, and our governments are facing competing priorities. Public attention has shifted even as pressures on the health system continue to grow. In this context, making real impact requires closer alignment and collective effort. It requires rowing in the same direction as a profession, as partners, and as an organization, rowing with you. It also requires us to frame our advocacy in ways that resonate with decision makers. That means positioning Medicare not only as a cornerstone of our country's identity, but as a nation-building project, one with profound economic, social, and workforce implication for Canada's future. One thing has become increasingly clear: no one moves the needle alone in a system this complex. And that is why partnership is central to how the CMA works. We place a strong emphasis on respectful, collaborative relationships with provincial and territorial medical associations. We recognize their leadership, expertise, and proximity to physicians. We work together, not duplicating, competing with, or diluting their efforts. We're also being more intentional about where and how we partner, not just working with more organizations, but showing up where key system decisions are shaped. Examples include our participation in the World Medical Association, the Canadian Medical Forum, and Healthcare Can. We're also embedding patient perspectives into our work, including through our Patient Voice Advisory Group, recognizing that meaningful change is built with, not just for, the people who rely on our system. And we're seeing results. Alex.
Thank you, Dr. Bernard. And as you've noted, our close work and collaboration with provincial and territorial medical associations and the Quebec federations over the past year have included speaking out against legislation that would undermine professional autonomy, patient rights, and access to care. So, for example, Bill 26 in Alberta, Bill 2 in Quebec, and the residency requirements for internationally trained physicians here in Ontario. Together with colleagues from 11 provincial and territorial medical associations and the Specialists Federation in Quebec, we held more than 50 meetings on Parliament Hill just last month to make our case and to ensure that decision makers would hear the voices of physicians from coast to coast to coast. Those conversations brought decision makers face to face with what's happening in exam rooms, hospitals, communities across the country, and how federal decisions can shape those realities. A major focus of that advocacy has been reducing administrative burden and fixing the systems that get in the way of care. Through the Our Care survey funded by CMA and led by Dr. Tara Kieran, we've gathered clear national data on patients' access to care. We've shown strong leadership on health data by advancing connected care legislation. And through our joint report with the Canadian Federation of Independent Business, we've shown how unnecessary administrative tasks pull physicians away from patient care and involve them in work that they would rather not do and that does not directly benefit patients. Last month, that work led to federal changes to streamline the disability tax credit application form, including who can certify eligibility. And this is a change that we have been long calling for. We're also pairing advocacy with practical solutions. Through the Healthcare Unburdened Grant, supported by CMA, Scotiabank, and MD Financial Management, Doctors Manitoba created a toolkit that helps employers comply with that province's new ban on sick notes for short-term minor illness. Through the CMA Foundation, we're funding the HELP program, which is helping newcomer physicians build language skills and integrate into the physician workforce more quickly. Beyond system reform, we're engaging the public to combat false health information. For example, through Healthcare for Real and Tellement Santé, now reaching more than 85,000 subscribers on YouTube. This time last year, they were closer to 0. We're advancing planetary health and climate-informed care through collaborations with Choosing Wisely Canada, the Canadian Association of Physicians for the Environment, and the World Health Organization. And we're undertaking national work on reconciliation including a comprehensive review of the CMA Code of Ethics and Professionalism in partnership with health and Indigenous organizations across the country and the Indigenous Guiding Circle. These efforts are being recognized. In 2025, the Hill Times named the CMA the most active health lobbyist and for several years running one of the top lobbyists overall. And this reflects the leadership and passion and determination of our outgoing president, Dr. Margot Burnell, who has worked so hard and traveled the country to deliver our important message. And our former president, Dr. Joss Reimer, now the Chief Public Health Officer of Canada, and our incoming president, Dr. Bolu Ogunmeni. Notre engagement envers les médecins francophones
Our commitment to Francophone physicians and our willingness to offer what we're doing is at the very heart of what it is we're doing. This translates into concrete actions. For instance, we met Quebec MPs during the last federal election, and we met with Dr. Jean-Joseph Condé, who was a member of our board of directors and a Francophone spokesperson. He welcomed the federal minister for health in his clinic in Val d'Or. This visit allowed us to demonstrate the true and real impact of the red tape and the lack of inter-transferability and operability when it came to Bill S5 on connected care. We were also present at key points when the doctors got together in Montreal to demonstrate against the provincial project Bill 2.
When the minister was in the University of Montreal for an event on artificial intelligence. We also dealt with the increasing challenge represented by fake information on health during a meeting held by the Quebec Federation of Medical Students. We've also strengthened our presence in the media, French language media across the country, with more than 100 media interviews in French over the last year. 41% were conducted outside Quebec, especially in Acadia, in Northern Ontario, and also in BC and Manitoba. All these activities are designed to support our priorities, to build trust, to strengthen links with our members, and to represent you in a concrete and significant way.
Looking ahead, we're entering the next horizon of our Impact 2040 strategy, focused on delivering results in clear priority areas, supported by measurable outcomes. Those priorities include access to primary care, physician burnout, false health information, and planetary health. And we're continuing, of course, our advocacy in Indigenous health alongside the CMA's Indigenous Guiding Circle, ensuring this work is grounded in partnership and accountability. A through line for all of those priorities is the exploration of how to ensure trustworthy and effective use of AI in healthcare. That means, of course, acknowledging legitimate concerns while expanding the conversation beyond risk alone to discuss opportunity.
Across all of this, we're taking a deliberate approach. We're staying responsive to change while remaining focused where we can best lead, convene, and influence. And as part of that work, we're also taking a close look at our governance and expect to bring bylaw amendments to the AGM next year in our ongoing efforts to respond to the needs of our members. We want to close by returning to purpose. The CMA exists to improve the health and healthcare for everyone in Canada. That purpose has not changed, but how we live it must continue to evolve. Progress depends on collaboration between physicians, patients, partners, and the CMA. It depends on listening, learning, and adapting together. We're committed to doing exactly that in the year ahead, and we're deeply grateful for your leadership, engagement, and contributions. We invite you to stay involved, keep challenging us, and help us keep pushing for what's right, for physicians and for the people that you care for. Thank you. Merci. Good.
Thank you, Dr. Bernard and Mr. Munter. I will now ask the CMA's incoming president, Dr. Bolu Ogunyemi, to provide his inaugural address.
Bonjour à tous et à tous.
Hello, everyone.
Hello, everyone. Changes in the healthcare landscape from the CMA's beginning in 1867 to today are as vast as the distance from Nunavut to Victoria to St. John's. Despite this, that which binds us as physicians endures: our dedication to patients and our desire to reimagine health delivery. But the privilege of practicing medicine brings a collective responsibility to confront pressing challenges facing healthcare. In a time of tremendous opportunity, digital health tools and artificial intelligence are having transformative impacts on health delivery. Artificial intelligence can improve workflows, aid in documentation, and help in clinical decision-making. As well, it can reduce administrative burden. We're experiencing increasing strain from unnecessary paperwork, which is taking time away from engaging with our patients face-to-face. Leveraging interoperative health records and other digital tools is key to a better way forward. Harnessing technology also means working with partners to reduce the harmful effects of false health information on patients and the way they make their decisions about their health. This emerging challenge is compounded by a more long-standing one: reduced access to primary care. While patients report that their family doctor is their most trusted source of health information, over 1 in 6 don't have access to one in Canada. From medical education to investments in planning and funding of health delivery, our focus on primary care must remain steadfast, given its foundational role in delivering health care. My father studied medicine in Lagos before completing his neurology residency at Western University and then a fellowship at the Mayo Clinic. He would later move to St. John's, where he's currently a full professor of medicine at Memorial University. For 35 years, he's been the only epileptologist in Newfoundland and Labrador. The second of 13 children, my mother shouldered responsibility from a very early age. Always a trailblazer, she was one of the first women in her region of Nigeria to attend post-secondary education. She got an MBA and applied this to help co-found one of the first African community organizations in Newfoundland and Labrador before becoming a serial entrepreneur. It is in this tradition that I understood from a very early age that integrity, dedication, and a vision for a better future can propel even the most unlikely journey.
It's in hospital that we heal, but it's in the community that people are given life again.
In a hospital, but they truly become well in their communities. And today, I have the privilege of serving patients in the very same community that raised me. We need greater support for community-based practices to enable doctors to be able to meet patients where they are. As a primary spokesperson of the CMA, I hope to use this position not only to influence policy, but to change understanding that diverse backgrounds make policy and advocacy efforts more inclusive and more effective. Perspectives of 2S LGBTQIA+ folks and those with different abilities must be reflected in health system design, delivery, assessment, and implementation. Indigenous ways of knowing, seeing, and doing continue to complement Western knowledge. The term planetary health had not yet been coined, yet Indigenous peoples have been stewarding Turtle Island since time immemorial. We have to be intentional in our efforts to deliver equitable health care to those of all faiths and cultural backgrounds, whether they're situated in rural, urban, or Indigenous communities. True reconciliation requires working alongside First Nations, Inuit, and Métis peoples, using our platform to help identify and remove barriers to health equity. We need Indigenous-led solutions. un système de santé qui est destiné à
A
fonctionner
healthcare system which is designed to work for everyone must be shaped and must reflect the way people live.
A healthcare system that is meant to work for everyone must be shaped by and reflect people of all backgrounds. Coming from a province where water has been so essential, I've heard folks say many times that a rising tide floats all boats. And indeed, when we're intentional about improving the health of the most marginalized, all of society benefits as a whole. A robust, publicly funded healthcare system based on need and not on the ability to pay is such a fundamental way that we in Canada show our care for one another. Among the youngest presidents in CMA history, I hope that my energy for our profession translates into policy change so that those who come after us may inherit a healthier nation. I have the fortune to live, work, and raise my two daughters, Ariana and Farah, in the traditional territories of the Beothuk, Mi'kmaq, Innu, and Inuit. As the first graduate of Memorial University's Faculty of Medicine to ever lead the Canadian Medical Association, I will bring not only the resilience of Newfoundlanders and Labradorians, but also our authenticity and our generosity of spirit. Between Quebec, Ontario, and the Maritimes, 4 medical schools had systematically declined admissions to students due only to the color of their skin. Black bodies denied white coats. Generations of changemakers, mentors, and leaders intentionally excluded from this profession. It is with great humility that I serve as the first Black president in the 159 years of the Canadian Medical Association and the primary spokesperson for this country's most influential health advocacy organization. I honor all of those of the African diaspora who have come before me to make this day come to pass. I may be the first, but I will not be the last. It gives me great hope to see those of all backgrounds that are encouraged to pursue medicine in helping develop a profession that more closely reflects those whom we are called to serve. Nous avons tous des talents uniques.
We all have unique talents that we can use to improve the healthcare system and the health of all of our communities.
Unique gifts that we must harness to advance health systems and improve health delivery in our communities. Et chez Pupo, merci beaucoup, Miigwech.
So thank you very much.
Thank you very much, Dr. Ogunyemi. I will now ask Dr. Aaron Chu to present the Audit and Finance Committee report, and I will ask Dr. White-Ulis to moderate the Q&A session that follows.
Hello, my name is Aaron Chu, and I am a neonatologist from Winnipeg, Manitoba. I serve on the CMA Board of Directors, and I am the chair of the Audit and Finance Committee. It has been an honor to serve on the board for the last 3 years. I have been a member of the Audit and Finance Committee since joining the board and became the chair in 2025. This is my first time presenting to the AGM. My qualifications for this role include an MBA and additional certifications in financial trust management, corporate governance, and audit, finance, and risk management. The Audit and Finance Committee is composed of 9 members: the chair of the CMA board, 4 CMA board directors, 2 members at large elected by General Counsel, and 2 external members with financial expertise who hold the Chartered Professional Accountant's designation. The committee is responsible for overseeing the overall financial management of the CMA, including financial risk management, the annual budget overview, and the external audit function. Reports from the committee are presented to the board of directors on a quarterly basis. At this time, I would like to turn your attention to the financial statements, which are available by clicking on the Resources tab. Please open the financial statements for detailed accounting of our organization's financial well-being. Your organization, the CMA, continues to be in excellent financial health. We have a strong foundation upon which we can execute Impact 2040, our strategic plan. I will now highlight key results from 2025. Building on what you have heard today from my colleagues and our CEO, the CMA board is focused on Impact 2040. In 2025, the CMA spent $73 million in advanced system-level areas of focus, expanding its capacity for engagement with physicians and key partners, and continuing its charitable giving efforts directly and indirectly through the CMA Foundation. Specifically, funds were allocated to the following areas. The CMA dispersed funds to a number of organizations supporting Indigenous organizations, medical education, and health journalism in Canada. During the year ending December 31st, 2025, a total of $25 million was committed by the CMA either directly or via its affinity agreement with Scotiabank and by the CMA Foundation. The CMA Foundation provided impactful charitable giving to multiple registered charities in Canada to further excellence in healthcare and support physicians and medical learners in Canada. One such example is the $2.2 million commitment to the First Nations Health Foundation's Cultural Wellness and Healing Grant Initiative. This program is a First Nations-led response and initiative providing direct investments to each of BC's 203 First Nations communities and to the urban and away-from-home population in each of the province's 5 health regions. Fiscal year 2025 was notable at a macroeconomic level. As the economy continued its slow recovery, interest rates declined, leveling to 2.25% by the end of the year. High inflation levels persisted, and the financial markets continued to see volatility. Despite the economic turmoil, yearly investment returns were higher than expected at 9%, driven by solid fixed income market performance. The strong investment performance builds on the 16% return achieved in 2024. Global investment markets are experiencing ongoing volatility and uncertainty. The investment team and investment committee continue to monitor the situation closely and manage risk appropriately. The investment portfolio is well positioned to sustain the financial strength of your organization in the long term. Investments are managed professionally by external managers, and their performance is subject to oversight by an investment committee composed of financial experts, reporting to the CMA Board of Directors. I am pleased to share that the 2027 CMA membership fee will remain at $195 for a 2-year term for all practicing physicians, representing the 7th consecutive year without an increase. The fee continues to be waived for students, residents, physicians in their first 5 years of practice, and retired physicians. With your support and engagement, we continue to advance our profession and influence and drive change through a united voice. Lastly, the board recommends the reappointment of Ernst & Young as external auditors. EY has served as the CMA's auditors since 2020, and both the board and management continue to be satisfied with their performance. The external auditor adds value to the CMA by ensuring the financial statements are fairly presented. In line with CPA Canada recommendations, the Audit and Finance Committee conducted a formal evaluation in 2024 to ensure the service provided by EY meets our needs. And EY's performance is also evaluated informally on an annual basis to ensure the board remains satisfied. In summary, the CMA continues to be in excellent financial health and remains focused on investing in issues and causes that matter to physicians. Your medical association is well positioned for long-term financial sustainability, which will allow the CMA to pursue ambitious system-level change for a better health system, better working environments for the profession, and better access for patients. In closing, I would like to thank members of the Audit and Finance Committee, as well as the CMA's financial staff, for their dedication and skill in overseeing these fiscal resources. Thank you for the privilege and honor to serve you as a board member and as a chair of the Audit and Finance Committee. At this time, I would ask the AGM Vice Chair to invite any questions before Dr. Béchard presents the motion with respect to the appointments of the auditors for consideration.
Thank you very much, Dr. Chu. I now invite members to click on the Q&A tab to type and submit your questions. A reminder that this time is for clarification of matters raised in Dr. Chu's report. All other questions will be published shortly before the general Q&A session, and members will be able to upvote at this time. I was just told that a member submitted a question via the chat. I would just ask them to submit the question via the Q&A so that members can upvote the question. So we'll give a little bit of time for that member to submit their question, as well as for any other questions that members may have. Okay, I don't see anything yet. We'll just wait for a second. I just want to remind the Assembly that we are not monitoring the chat for questions. So if you have questions that you want answered, please ask them in the Q&A. Perfect. So I do see one question in the Q&A from Dr. Gemstone Beth. Considering the hallucinations of AI scribes and the unethical practices through which generative AI is produced, wouldn't a more ethical and inclusive approach be to utilize human scribes who are part of the communities we serve?
I'm not sure that I could answer that on behalf of the Audit and Finance Committee. I'm wondering whether that question could be better posed to the general Q&A.
That sounds very reasonable. So we can wait until we have CMA leadership who does not strictly focus on finance to have this question answered, but I promise Dr. Bath that we will get to it a little bit later. I will give a little bit of time for any other questions on financial matters for Dr. Chu. Just giving a bit of time for anyone who may want to ask a question to get into the Q&A and type it. Okay. I have another question on a similar topic, but with a more financial bent to it from Dr. Hamadeh. Would the CMA be willing to finance CMA members for AI scribes in challenged provinces?
With your permission, I think this also might be better asked from the CMA leadership team in the general Q&A. I think the two questions are very similar, and as a theme might be best answered by our CEO and our board chair as well.
Okay. So we'll make sure that we keep those questions in for the general Q&A so that they can be answered by CMA leadership. I don't see any other questions in the Q&A currently, so I will turn it back to you, Dr. Bichard.
Thanks, Dr. White-Ulis. I know it can be difficult to know when and where to pose your question. Generally, questions about how the organization spends its money, what its priorities are great for the leadership. But if you're asking about money that's already spent, that's a great opportunity for the Finance, Audit, and Risk Committee. But we have a motion before us. So the mover of the motion is Dr. Aaron Chu. The seconder is Dr. Andre Bernard. The motion reads, the Canadian Medical Association hereby appoints Ernst & Young LLP as external auditors of the association to hold office as auditors until the next annual meeting of the association or until their successors are appointed. Again, this type of motion is generally non-controversial. However, if there is any objection to this motion, please click on that engagement tab, select the Speak to a Motion button from the drop-down menu to let us know that you'd like to speak verbally to the Assembly. Okay, please stand by as we check to see if there are any objections. And just so you know, if there's no objections, we'd pass by unanimous consent. If there are objections, then we'd probably go to a vote. Perfect. I hear that there's folks who are making their way to discuss the motion. That's great. Give us a second to make sure everybody can be uploaded into the Zoom room. Usually it takes about 30 to 60 seconds or so. Okay, we have someone who signified their wish to speak, but they haven't made it to Zoom yet. It's no problem. We have fun facts prepared for these lulls just like this. So last year, we do read all the feedback from the evaluations from the annual general meetings. And we had an interesting split last year where some folks said we talked about chinchillas too much, and others said we spoke about them not enough, and they wanted to hear more. So I think we spoke about them just the correct amount. But just in case, I have fun facts about other animals. So my second favorite animal after chinchillas is the North American opossum, which is North America's only marsupial. And one fact that I shared during our rehearsals yesterday, which I think is fascinating, is that their body temperature runs so low that it's very hard for the rabies virus to survive in possums. So I'm not saying that you should pet any wild animals, but if you did have to pick one that's relatively safer to pet and less likely to transmit rabies, it would probably be the opossum. And if you don't know what they look like, look up some pictures of them, and they are extremely friend-shaped, I think is the technical term.
Dr. Bichard, I feel more educated every year from hearing your fun facts about animals.
I'm so glad to share my hyperfixations with the assembly. All right. And hopefully, it's hard to find fun facts that are relatively non-controversial, but who doesn't love, maybe I'll find something horrible about opossums, that they're destroying the habitats of other animals or something. Sounds good. So I've been told that the person who indicated they wish to speak has not made their way to the Zoom room yet. We're not sure if they're just experiencing major technical difficulties or changed their mind. We're going to give it another 15 seconds and then probably move on. I do see that there is the name of another individual who would like to speak for or against the motion. Okay, it's the same situation for both individuals where they've been invited into the Zoom room, and we're just trying to sort out if it's a technical issue or if folks have just misclicked. I know it can be pretty easy to misclick on the platform, or of course, people can change their mind. All right, we'll give it another 10 seconds or so. Thank you for bearing with us, everyone. We recognize that virtual meetings and managing the platforms can be challenging, and I don't mean to delay the assembly's time. But we want to give everybody a chance to an opportunity to participate if they can. All right, I've been told nobody has entered the Zoom room, so we will proceed. So we'll stand by to see if there are any more objections to this motion. I think you've had a decent couple of minutes while listening to me drone on about opossums to say if there's any dissent, but especially as chair, I don't want to adopt anything by the principles of unanimous consent without ensuring that there truly is unanimous consent. So if there's any dissent or concern about this motion, you've got another 10 seconds to indicate. Okay, oh, and we've heard from the participants that there were some misclicks. Thank you for that. And sorry, I know it's extremely easy to do. I've done it myself on the platform. Okay, I think at this point, we can safely say that there is no objection. So we will pass motion AGM 2 using the principle of unanimous consent under Robert's Rules of Order to pass a motion without debate and without voting directly on it. The motion is carried by unanimous consent. Thank you very much for your report, Dr. Chu. And I will now ask Dr. Nigel G. Walton to present the Governance Committee report. And I will help to moderate the Q&A session that follows.
Hello, bonjour. My name is Nigel Walton. I am a general practitioner in West Vancouver, British Columbia. This is my first report as chair of the Governance Committee. With the exception of nominations and appointments, the Governance Committee advises on all aspects of governance of the association. The committee makes recommendations to the board throughout the year and to the membership at the annual general meeting. Here are the names of the current members of the Governance Committee. The committee is made up of 4 directors appointed by the board and 2 members at large selected by the Nominations Committee and approved by General Counsel. The current member-at-large positions became vacant when Dr. Ugunyemi and Dr. Bernard took up their respective positions as President-elect and Chair of the Board of Directors. The confirmation of new members-at-large of the committee will be considered by General Counsel later today. This year, the operating rules and procedures were amended to align with the bylaw changes that were approved last year. These moved membership from annual terms to set periods that align with career stages. Here are the membership categories, terms, and fees effective January the 1st, 2026. There is a lot of detail on the screen, and you can also find this information in the annual report, which is under the Resources tab. No bylaw amendments are currently proposed this year, and as mentioned by the board chair, we expect to bring amendments to the AGM next year. That said, we welcome and we encourage member proposals on business and governance related matters. And this year, we have received one proposal to move to a national election for the president-elect. This is currently under consideration, and further information will be shared with members in due course. That concludes my report, and I would welcome any questions that members may have.
Thank you, Dr. Walton. I'd now like to invite members to ask questions on the Governance Committee report, and we have Dr. Bernard, who has made his way to the podium to answer any questions. Any unanswered questions will remain available for upvoting and may be addressed in the general Q&A session. We have a brief 5-minute period here for governance questions, but again, if nothing comes through, we'll put them to the general Q&A. So please stand by while I check to see if there's anything in the Q&A. I know we all hear it in elementary school, but there's truly no dumb questions. I'm sure somebody else at the assembly would have the same question as you.
Dr. Bishard, I'll say that in the interest of fun facts, as I've stood at this podium previous years, I'm passionate about governance, and I found a governance friend in my colleague, Dr. Walton. So I would say we are happy to take any questions, both in this forum or at any point in time. So it's nice to have friends.
What I'm hearing is that Dr. Bernard will be very sad if there's no governance questions. So please help keep this grown man's mood up. Here we go. They're coming in. Okay. So first off, we have a question from Dr. Jerry Prince. Will the bylaws review mentioned in the CMA leadership report correct some definitional errors, specifically referring to the ratification by members of board-selected candidates for board positions currently referred to as election? The term election, by any definition, including within Robert's rules, implies choice presenting names, which I think he got cut off, or they got cut off after which. But I guess there are some questions around the definition of election, and if that will be one of the items in the bylaws to potentially be targeted and changed in the future.
I'm happy to take a kind of an initial reply to that. Thank you, Dr. Prince, for raising your question. I'll say, just generally speaking, the observation that you've made that that there are a lot of legacy items in those bylaws, because in fact they were constituted in their original form, I think in 1908 or 1909, and built upon over time. Certainly, that's a consideration that is part of how we move and modernize bylaws, not just for next year, but into the future. In terms of the specifics around the language around election, let me take that away, and we'll consider that further. Certainly, we would say that currently the General Council delegates elect the slate of nominations that are brought to it, which is in line with our bylaws and our operating rules and procedures, which are on cma.ca and in the resources tab of this document. But certainly, as we approach these considerations, we'll be looking at addressing any language gaps or terminology mismatches that may be legacy provisions in the bylaws.
Thank you for the question, Dr. Prince. It's not a question, but I'll allow it because we have some time, from Dr. Gracia Hamade, who says the membership fees are very reasonable. Thank you. And I noted that Dr. Baith has helped us correct the pronunciation of their name.
Can I just do a shout out? I've had the opportunity to meet the member that just made that comment and is a newer physician to Canada. So I just want to extend our gratitude to you, Dr. Garcia, for your comment.
Perfect, thank you, that's great to know. And I was just about to say that Dr. Baith in the chat has helped us correct the pronunciation of their name. Again, we're not moderating the chat, but that is a good place to put it. We'll try to keep an eye on it if you would like for us to try to pronounce your name correctly. But thank you very much, Dr. Hamade and Dr. Prince, for your comments and questions. We only have 10 seconds left, so I believe that will conclude our time for the governance Q&A portion. So thank you very much to Dr. Bernard and Dr. Walton. We will now shortly move into the general Q&A session, which will be moderated by the wonderful Dr. White-Ulyss.
Thank you. So questions may be upvoted by members to help determine the order in which they are answered. We will take questions in both English and French. Please note that only CMA members may submit and upvote questions. Dr. Margot Brunel, our outgoing president, will respond to policy-related questions. Our CEO, Alex Munter, and our board chair, Dr. Bernard, will respond to questions related to CMA strategy and corporate matters. Dr. Jeff Blackmer, Chief Medical Officer and Executive Vice President of Professional Practice, will answer questions on ethics. And the chair of the Audit and Finance Committee, Dr. Chu, will answer questions related to their area of focus. And finally, Dr. Jean-Joseph Condé will answer French questions or redirect them as appropriate. Welcome, everyone. So to no surprise, you'll hear that my first question will be about AI scribes and comes from Dr. Hamade. Would the CMA be willing to finance CMA members for AI scribes in challenged provinces? And I will direct this one to Alex Munter.
Thanks for the question, and that's a live conversation. I'll take that question as a suggestion that it's something we should do, and we are looking at how we can best support physicians in their clinical practice with the rapid evolution of technology. So maybe if we could take that away, and hopefully next year we'll have a bit of a story to tell for you on that.
Perfect. Our second question from Dr. Baith is also about AI scribes. Considering the hallucinations of AI scribes and the unethical practices through which generative AI is produced, wouldn't a more ethical and inclusive approach be to utilize human scribes who are part of the communities we serve? Dr. Brunel, do you want to take a stab at this one?
Sure, thank you. The AI scribes are being tested in many life labs across the country. The ultimate responsibility to ensure that the notes and documentation is still left with the physician to ensure that there are no hallucinations within those notes. That goes to the fact that we are recommending oversight and regulations to ensure that AI is adopted with the endpoint of patient safety as the #1 concern.
Thank you, Dr. Brunel. Our next question will be for Dr. Chu, so I'll ask him to make his way to the stage. The question is there a strategy for deployment of CMA funds reserved for grants? And if so, can you describe that strategy?
Thank you. That's a very excellent question. And that really deals with CMA Foundation, the foundation which provides funding for grants for not-for-profits. CMA itself does run some grants, but not on its own enterprise. It goes through other entities like the Affinity Program, as well as the CMA Foundation. And if you would like, I'm sure any of the leadership team would be able to provide you with additional information about how to access those.
I think our CEO also had a comment on this one.
If I could add to that, the board has established a series of priorities for our work, and from a kind of thematic perspective, those are improving access to primary care, improving Indigenous health outcomes, addressing planetary health, combating false health information, and tackling the issue of physician burnout. And AI, for example, and innovation is a kind of through line that enables those, that is one of the hows for some of those priorities. In terms of CMA giving, which, as Dr. Chu has noted, comes through the CMA Foundation and through various other channels, those are the priorities. So the board has established what our focus will be over the next number of years in organization, and our giving and our support for community partners is based on those priorities.
Thank you both. Our next question will be for Dr. Bernard as it relates to member engagement. Healthcare and societal discussions have become increasingly polarized. How is the CMA approaching the challenge of maintaining psychologically safe, respectful professional dialogue while still allowing space for meaningful disagreement and advocacy diversity within the profession?
Thank you, Dr. Foltz, for that question. And isn't that the question facing many of our medical organizations, including our PTMAs? Certainly, our commitment to creating, first, within our own environment, our own ecosystem, our CMA committees, this meeting, for example, we're committed to creating a safe space where inclusion and equity, diversity are ensured. Kind of principles on which our engagements are based. You know, as I think about the work that our president, Margot, over the last year has done in engaging with physicians, we do hear, you know, a lot of struggle with respect to the issues facing their lives. And we hear in our healthcare institutions strain in terms of civility at times. I think, you know, we want to cultivate those, to your point, we want to cultivate spaces where we can disagree in a civil way and find a way forward. I just want to open it up to our other leaders to see if they want to add to that in any way.
I would just say that listening to members and allowing safe spaces really brings all the perspectives of the membership to the table. And by that process, we can provide the best solutions, tell the best stories, and ensure that all the environments where we practice medicine are culturally and psychologically safe.
And maybe I'll just add for a moment, if I could. You know, we are seeing a manifestation of our real environment right now. So I think, you know, tackling these things on the upstream, working for improving working conditions through administrative burden, advocacy, I think are places where if we could take some of the pressure off and cultivate places where people can have the safe conversations, as Dr. Burnell mentioned, I think that's a space that we can play in as well.
Thank you, doctors. Dr. Burnell, don't go anywhere because this next question is also for you. Canada has severe structural shortage across virtually all medical specialties, characterized by massive wait times. Specifically, what actions has the CMA taken to directly address physician shortages in all specialties in Canada, including licensing international medical graduates and associate physicians / clinical assistants?
So the areas that we have been most involved with have been retaining physicians and recommending strategies for wellness and work-life balance, safe spaces within the clinics, and decreasing administrative burden. The other is to recruit, and we have been very strong in looking at integrating internationally trained physicians into our healthcare system. So we were pleased with the announcement by the Federal Minister of Immigration with respect to entry process being streamlined for residency status and increased into the provincial nominee program. We also are advocating for a streamlined process from the time that individuals expressed interest in coming to the country, to obtaining their residency, to understanding where they might want to work and where the openings are, understanding how to get their registration with the colleges and their license, and then credentials at the health authority level, and then integrating them into the community and providing ongoing support to not only the physician, but also to the family who often accompanies them. We are recommending expansion of the practice-ready assessment programs, which many provinces have, to standardize them and improve access for physicians to be assessed so that they may enter the workforce as compassionate and competent physicians.
Can I just add, because I've often been in the room with Dr. Burnell when she's met with members of parliament, ministers, premiers, and I think there may be an exception, but I think pretty much every single time that I've heard Dr. Burnell speak to a decision maker, she's talked about health care workforce issues, the need to train more, keep more, support physicians more. So as a member, Dr. Shornick, you can be assured that Dr. Burnell has really been taking that message to anyone who will listen, and even to some people who might not.
Thank you both. Avant de continuer avec la période de questions,
Before we continue with question period, I'd just like to remind our Francophone members that you can submit your questions in French. It will be a pleasure for us to read them and to direct them to the appropriate person.
This question is for you again, Dr. Burnell. I'm making you work hard on your last day in office today. Considering the evidence-based positives from whole food plant-based eating, how would the CMA support this target for the profession and the community?
So we have been involved with multiple stakeholders with respect to climate and engagement, and have focused one of our key initiatives around climate and education. We have been involved in discussions at the Globe and Mail Center with the Trottier family looking at planetary health. We've advocated to bring together all the resources in a national strategy, and we look forward to also advocating for the development of climate and education within the medical school programs across this country.
Thank you, Dr. Burnell. The next one is also for you. Can CMA play a role in supporting doctors to advocate for being billed for complexity index of diseases in primary care?
So billing is really at the provincial level with negotiations between the medical societies and their Department of Health. But in our initiative of access to care, we have really endorsed the fact that longitudinal care amongst primary care teams and professionals are critical and essential. They decrease morbidity, they decrease mortality, they have better outcomes for patients, and patients are more satisfied with the care that they receive.
And could I add to that? And I don't know where the questioner, which province the questioner is in, but just to reassure you that this is very high on the priority list of the provincial territorial medical associations, and we're certainly happy to support them in however we can as they address this issue with their respective governments.
And if I could just reiterate, as Alex had mentioned in his remarks, one of our key strategic areas, as Margot has mentioned, is strengthening primary care in this country. So looking at all levers through partnerships, to address that is really what we're trying to advocate for. So solutions across the board, your ideas are things that we're very interested in.
Thank you all. Dr. Burnell, I'm going to give you a break and direct this next question from one of our medical student members to Dr. Bernard as well as Alex Munter. As a medical student, I appreciate the CMA's work in areas such as Indigenous health and equity. As conversations around physician well-being continue, how does the CMA work with trainees and physicians from underrepresented communities to address ongoing barriers in medicine and ensure well-being and equity remain integrated into advocacy and leadership?
So thank you for the question, and in fact, our new president, Dr. Agunyemi, spoke exactly and directly to this issue in his inaugural address a few moments ago. This really is baked into both the culture of CMA and our work planning. We recognize the importance, whether it is Indigenous learners, Black learners, others from various equity deserving groups. We have, through our advocacy on the policy side, for example, when the Government of Ontario took measures to make access to training more difficult. Through our giving stream in terms of supporting organizations and working closely through our role in medical education, including the accreditation of medical schools, to ensure that these issues are addressed.
And if I could just add a few themes. I mean, there's a lot of Dalal, sorry if I mispronounced your name, a lot of themes in your question, which I can see on the monitor here. I'll say that from a governance perspective, we see cultivating our own fora through governance, through the structures of our committees, our leadership opportunities, seeing EDI-RA as a clear lens for recruitment and involvement, and cultivating, again, a workplace, a policy space for our members, including you as a medical student, where we seek always to remove all barriers and promote wellness in the work that we do as well. Yeah, so I think this is a commitment. It's a lens through which we see all of our work. It's a commitment through the apology that we've made in the past and our ongoing commitment to you as members.
Oh, and maybe I could do a promo for our ambassador program, which involves medical students from schools across the country, engages you in the work of the CMA for sure, but also in the broader medical community, and would encourage folks to look that up on our website and submit your name if you're interested.
Thank you both. Dr. Brunel, the break was short-lived, as this next question is for you as well. Canada's emergency departments are under incredible strain. Deaths in the waiting room are now commonplace. This is a national crisis. Can you outline how the CMA is approaching this? There is a dire need for accountability in the system, and I think a national approach could be very valuable.
So thank you for the question, and certainly it is a situation that goes from coast to coast to coast. We have been able to liaise with our medical associations, provincial medical and territorial associations, to support their discussions with the government in many of our provinces across this country. We know that the emergency department, can't control what comes in its doors, and much of the restrictions are related to outflow to inpatient wards and to those that have need alternate level of care. So we are constantly advocating for the right care at the right time in the right place. We will continue to have that and to continue to ask that there be accountability measures, both from the profession to our patients, but also from government to our physicians, in how dollars that are transferred to solve some of these problems are actually going to solve the problem and come up with solutions.
Thank you, Dr. Brunel. One more for you. What policies should Canada prioritize now to prepare for a future pandemic and improve critical care surge capacity?
So I think we have a great advocate in our Chief Public Health Officer, Joss Reimer, previous president of the CMA, and she has the skill set and the relationships to dialogue with the ministries to ensure that, and the knowledge to ensure that we have a plan in place for any future outbreaks. We've learned lots of lessons, and I think she's shown great leadership, as well as the Public Health Agency with our most recent infections across the world.
Thank you, Dr. Brunel. One more for you related to health human resources. What strategies has the CMA in place to support internationally trained physicians who relocated from war zone countries? doctors who are doing their due diligence in serving patients yet living in multiple time zones as their families are at safety risks.
Would you repeat that, please?
Yes, no problem. What strategies has the CMA in place to support internationally trained physicians who relocated from war zone countries? Doctors who are doing their due diligence in serving patients, yet living in multiple time zones as their families are at safety risks.
So we are advocating to have the development of and transition from temporary to permanent residency. We are advocating to ensure that families are kept together, and when families do come, that they are supported. I would say there are ethnic communities, one in Nova Scotia, who have sponsored bringing their colleagues to this country and have provided that care and support of their community when they have arrived.
Can I just add something in terms of from a CMA perspective? So first of all, shout out to the College of Physicians and Surgeons of Nova Scotia, a very innovative program to support internationally trained physicians as they integrate the healthcare system in Nova Scotia, not just in terms of the clinical supports that are required, but some of the other supports that any newcomer to the country needs. So we've been in conversation with them. We're learning from what they're doing. It's a great, one of the downsides of Canada sometimes can be we have 13 health systems and that can be clunky, but one of the upsides is we have jurisdictions that innovate, that come up with great models, and there's an opportunity to think about how we can scale those across the country.
And if I could just maybe add another perspective, I hear some pain in the question that you're asking, Dr. Hamadeh, and I'll say that as part of the ongoing work that we are doing in the physician health space, I think recognizing that the physician needs of today's population with respect to wellness, physician wellness, may be evolving. So we'll take that away as a thought to look into in the future.
Okay. Thank you to all three of you. I just want to remind the Assembly that we have just under 15 minutes left for our Q&A session. We will proceed with a few more questions and then stop for a 10-minute break before moving to the Nominations Committee report. So given that the next question is around a similar topic, I will send it back to you just to see if you have any more questions or any more comments, rather. While we face critical shortages in several specialties, highly qualified IMGs and Canadian-born IMGs face a bottleneck during the CARMS match due to strictly segregated streams. What specific actions is the CMA taking to lobby provincial governments and faculties of medicine to expand postgraduate training capacity and remove these barriers?
So we've partnered with the colleges and had dialogue with the College of both Family Physicians and the Royal College with respect to how best to deal with some of these issues. And there is movement on both colleges to recognize the struggles and barriers to internationally trained physicians. We've also helped with some of our foundational giving with respect to helping trainees who have come through the HELP program based out of Ontario, so Health English Language Pro. So basically to help individuals who are newcomers to understand the language and also the healthcare system. And we are advocating for basically a concierge type style where individuals basically are chaperoned through each step of the process from expressing interest to practicing in communities. So it's a keen interest, there's a lot of work, and we welcome any other suggestions. We also advocated very strongly when there was a change in the rules for the CARMS match within Ontario, and with much of our stakeholder engagement of the ITPs and the Black community and others, we were able to get a pause on that and a revision, and that's actively being discussed by the deans of medicine in the colleges.
And maybe to add to that as well, Dr. Fuenzalida, from an organizational perspective, beyond the advocacy space we play in, we also sit at a number of national tables where these very issues are discussed regularly. Or entities like the Canadian Medical Forum, interfacing with the Federation of Medical Regulatory Authorities of Canada, FEMRAC, the Royal College of Physicians and Surgeons of Canada, CFPC, and so on. So maybe just know that when we hear concerns that are being raised, we have places that we can share in discussions with national organizations, and Alex's team are in, from staff to staff perspective, in regular touch with many of those organizations as well.
Thank you very much. Dr. Chu, I'd invite you to make your way to the stage, as this next question is for you. First of all, thank you the great job the CMA has and continues to do on behalf of physicians and patients of Canada at a time when healthcare systems are literally crumbling. For Dr. Chu, what is the amount of funding that goes to the CMA Journal?
Thank you. That's a very good question. The CMA Journal, which is an excellent Canadian journal funded by the CMA, costs approximately $6 million a year for publication. The net cost, the total cost is actually offset by advertisements that is sold to advertisers within the journal itself. To try to limit the increasing cost of the CMA Journal, we've been able to do other changes. The publishers have gone to a less number of journals per year without impacting the actual advertisement dollars and without changing its very impressive impact factor.
Thank you very much. The next question is for you, Dr. Burnell. How can CMA support our advocacy in Nova Scotia with the provincial task force on the official recognition of obesity as a chronic disease, working to create a physician's billing code and improving access of care to patients?
So the best strategy is really to discuss that at the Nova Scotia Medical Society, build your network of interested specialists in that, and bring it forward to have a code with respect to that. Based on the ability to scale best practice, then that opportunity can go across the country. And those projects can also be championed when the CEOs meet between CMA and the provincial and territorial ministries.
Thank you, Dr. Burnell. This next question might be a sign that you all did a great job answering the questions, because there is interest in joining the CMA leadership team. So I'll direct this question to Dr. Bernard as board chair. What does it take to join the CMA leadership team?
Yeah, so I can address that. So CMA leadership positions for physicians, medical students, medical learners get posted each August. And after that, you'll see an array of vacancies that are available, and members are invited to apply, and then they're put through a process that is very robust through our nominations committee, which actually will be having a report later on this afternoon. You can see the back end of what it looks like at the end of the process today through the end of this meeting. But every year, depending on the committee vacancies, there are positions available, and that we really encourage you to apply to. And certainly, the way the question is framed, if you're asking about actual jobs with the Canadian employment with the Canadian Medical Association, that rests with Alex Munter and his team, and certainly that's in the usual fashion as postings come available.
Thank you. I can actually briefly add to that answer. I know folks have forgotten I'm here. I believe, just based on the comments and questions, Dr. Hamade might be coming from Nova Scotia. And if I'm not mistaken, the election for the next CMA president-elect is coming from Nova Scotia. And I believe the deadline is June 17th. The call for interest is June 17th. Anyway, check it out on the CMA website for president-elect elections, but they will be coming from Nova Scotia. So for those in that province, please do consider running.
Perfect. Thank you, Dr. Bichard. We actually have a couple more questions. So the first question will be for Dr. Burnell. Are there concerns that Quebec trainees may be at a disadvantage when trying to match or transition elsewhere in Canada, whether because of differences in training structure, language, interprovincial recognition, or networking exposure? And if so, what could the CMA do to improve national mobility for Quebec medical student professionals?
So I think it's really taking the opportunities at our various tables to bring up that concern, to bring it up with respect to, MCC and federal FEMRAC, as well as the deans across the medical community. We've done a lot of work with respect to multi-jurisdictional licensure, with respect to physicians, but we hear the concern of residents and medical students having the opportunity to practice perhaps outside the province where they have been born and raised or done their undergrad degrees. So I think that highlights the discussion that for individuals to be recruited back to their provinces, a call out to provincial ministries to ensure that they have welcoming environments to keep the students and to retain them within their provinces.
Perfect, thank you, Dr. Bernal. And our last question for this Q&A session will be for Dr. Bernard. How can physicians send the CMA ideas and solutions regarding the medical training of physicians and the operation of our health system? How can we best advocate for healthcare reform?
Great, Dr. Shornick, thank you for that question. And I'll open it up to the rest of the panel to respond to it. Listen, we want to hear your ideas. Your ideas certainly have been transmitted here in this session through the questions that have been raised. Refer you to the CMA website where your ideas and thoughtful inquiries can come through email to us. We have many opportunities, and we're trying to build those, including regional member forums across this country. Margot, Dr. Bernal's President's Tour that has just wrapped up, and subsequent presidents, same tours that are coming up. So get out and share your ideas on advocacy issues that matter to you. The specificity around medical training of physicians and the operation of our healthcare system, I think we need to hear more a little bit about the perspective that you're bringing to that. But certainly we invite you to share with our elected officers as they are available to you as well. Others, go ahead, Margot.
I might just add that we've been asked to present to the Canadian Federation of Medical Students on a couple of occasions with topics as they feel important. But that is an opportunity to share the ideas and that come from the medical students. We've also chatted about how to get information in and to share the information that they're bringing to the CMA and to share that across the country. So work is underway to increase the dialogue with our younger members.
Et je pourrais ajouter en français, au niveau du Québec
I might
aussi,
add that when it comes to Quebec, do not hesitate to write to us, to write to CMA AMC, and to participate. We are part of several events. There's the conference in November. Come to see us. Come to meet us. Talk to your provincial associations. And we have the Fédération des omnipraticiens from the Specialist Federation in Quebec. Come to see us. Come to meet us. We'll be delighted to talk to you.
Another channel, in addition to all of the various events that you've heard about, virtual events as well, like virtual town halls. We also, and I know physicians get extensively and some feel excessively surveyed. So we are both part of the problem and solution there. But we do survey members, we survey physicians, we hold focus groups. So that's another channel through which you can share your views, and we're keen to hear them.
And if I could shout out to my passion for governance again and say that we do have a formal process, which is called the Health Policy Proposal Process. You'll find that on the website where you and 9 other members can get together and put forward an idea around that you want the CMA to follow up on, and that can be considered. And the process is detailed carefully on the website, and certainly any members of our staff team through email can address any questions about that process. So really encourage using those mechanisms as well.
Thank you very much, everyone. I'm very sorry to say that is all the time we have for today's Q&A, but
Can I
Oh.
interrupt? Just, can I borrow 10 seconds of
You
your
can
time?
borrow 10 seconds, Mr.
Yeah,
Winter.
literally just 10, maybe 15 seconds. I just want to say it takes many, many months of preparation to put together an AGM. And so I just want to acknowledge, I'm the one staff person up here, but I'm probably the one in the room that's done the least to get prepared for this AGM. I do want to thank the members of the governance and legal team, the engagement team, including the events group, finance, IT, francophonie, who have worked really hard to put on this AGM and create this opportunity.
Thank you. That was well worth the interruption, even if it was 40 seconds, but that's okay. Nobody's counting. So the next item on today's agenda is the receipt of the Nominations Committee report by the General Council delegates from 2:40 p.m. to 3 p.m. Eastern Time. Please take a second to do the math if you're elsewhere in the country. But before that, we will take a short break. If you are registered as a General Council delegate, please return at 2:40 p.m. Eastern Time to vote on the slate of nominees for CMA leadership positions. If you are not a General Council delegate, you're welcome to stay on as an observer, but please note that only delegates will be permitted to vote. And a reminder that the chat function located on the navigation panel remains open for you to connect with other attendees. There's some lovely comments in there right now. If you are leaving the meeting at this time, please note that you will receive a meeting evaluation within the next few days. Your feedback is really important to us. As mentioned, we do actually read it, and we encourage you to take a few moments to complete it. Please note, mark your calendars, that the next virtual AGM will take place on Thursday, June 3rd, 2027. There being no further business, I declare the AGM adjourned. The Nominations Committee report meeting will begin at 2:40 p.m. Eastern Time in just about 10 minutes. Hello and welcome. I call to order the 2026 meeting of the Canadian Medical Association General Council Delegates. My name is Dr. Melanie Bichard, and I am the Speaker of General Council. My colleague, Dr. White-Ulyss, was appointed by the CMA Board as Interim Deputy Speaker due to a current vacancy. I would like to also introduce off-screen Mr. Dave Bennett, a parliamentarian and meeting support specialist who will help facilitate the conduct of General Council business today. We currently have 87 delegates online for today's meeting. The CMA bylaws establish quorum at 50 delegates, so we're ready to get started. A reminder that you should be joining us today using a computer or a tablet to fully participate. This will allow General Council delegates to submit and upvote questions, the General Council delegates to participate virtually and vote. I now call on Dr. Kathleen Ross, former CMA President and past Nominations Committee Chair for 2024 to 2025. She will present the Nominations Committee report on behalf of Dr. Joss Reimer, who served as Chair for 2025 to 2026 and resigned effective March 31st, 2026 to assume the role of Canada's Chief Public Health Officer. Please go ahead, Dr. Ross.
Hello, bonjour. It's my distinct pleasure to be with you here today and share the 2026 Nominations Committee report. Dr. Gerard MacDonald, Chair of the Appointments Committee and member of the Nominations Committee, will assist me in the Q&A session that follows. I would first like to thank those who served as CMA leaders this past year and whose terms will conclude at the end of today's meeting. On this slide, you will see outgoing members of the CMA Board of Directors. Then, we have the outgoing members of the Committee on Ethics and the Governance Committee. Lastly, we have outgoing members of the Nominations Committee. I'll now report on the work of the Nominations Committee over the past year. The committee comprises of one member from each province and territory, one affiliate society member, one resident, one student, and the chair of the Appointments Committee and the CMA's immediate past president. Members of the Nomination Committee are approved by General Council. Under the bylaw, the committee's primary task is to recruit and secure strong, balanced leadership for the CMA. We do this through a thoughtful and rigorous nominations process that's open to all eligible CMA members. This process aligns with the bylaw's operating rules and procedures and rules of order to ensure it is fair, transparent, effective, and expeditious. Details of this process are outlined in the Nominations Committee report, which was emailed to General Council delegates and published on cma.ca. It's also available in the Resources tab of the meeting platform and includes biographies of all nominees being presented for approval today. In August 2025, calls for expression of interest were sent to all CMA members, as well as to over 75 organizations, including those representing historically underrepresented groups, to encourage applications that reflect the diversity and the skills of the profession. Applicants for the 2026 leadership position were required to respond to 4 substantive questions related to experience, competencies, achievements in equity, diversity, and inclusion, and/or reconciliation, and their ability to contribute to inclusion. Applicants were reviewed by working groups made up by the Nominations Committee members. The working groups conducted interviews and background checks for certain positions and recommended 1 candidate per vacancy to the full committee. The Nominations Committee then considered those recommendations and is bringing forward a slate of nominees for your approval. I would like to take a moment to recognize the passion, the diversity, and skills of the many candidates who applied. The level of interest and high caliber of applications is impressive. Thank you to all who participated in the process. A different process is prescribed under the operating rules and procedure for the president-elect nominee, who is chosen through an election that is open to all members of the relevant provincial or territorial medical associations who are also CMA members. This year, the president-elect nominee comes from the Northwest Territories, and the electorate consisted of members of the Northwest Territories Medical Association who also held CMA membership. I will present the slate of nominees for all leadership positions. General Council delegates will be asked to vote to approve the slate en bloc. Please note that in accordance with our bylaws, there will be no nominations from the floor. Only nominees selected through the nomination process are presented for general counsel approval. The position categories listed on the slide, positions confirmed today, will come into effect following the meeting. Now you will see on the slide the name of Dr. Courtney Howard for President-elect for a one-year term en route to serving 1 year as CMA President and for a final year as past President. We have one incumbent nominee from Manitoba for a second 3-year term on the Board of Directors. One nominee from New Brunswick for an initial 3-year term on the Board of Directors. One nominee from Newfoundland and Labrador for an initial 3-year term on the Board of Directors. We have one nominee from Nova Scotia for an initial 3-year term on the Board of Directors. We have one nominee from Saskatchewan for an initial 3-year term on the Board of Directors. We have one nominee from the Yukon for an initial 3-year term on the Board of Directors. There's one incumbent nominee for a third 1-year term in the resident position on the Board of Directors. We have one nominee for an initial 1-year term in the student position on the Board of Directors. One nominee for an initial 3-year term in the AGM Vice Chair position. We have one nominee for an initial 3-year term in the Quebec position on the Committee on Ethics. We have one nominee for an initial 1-year term in the resident position on the Committee on Ethics. One nominee for an initial 1-year term in the student position on the Committee on Ethics. We have one incumbent nominee for a second 3-year term in the member position on the Audit and Finance Committee. We have one nominee for an initial 3-year term in the member-at-large position on the Governance Committee. We have one nominee for an initial 3-year term for another member-at-large position on the Governance Committee. One incumbent nominee for a second 3-year term in British Columbia's position on the Nominations Committee. We have one nominee for an initial 3-year term in the New Brunswick position on the Nominations Committee. One nominee for an initial 3-year term in the Nunavut position on the Nominations Committee. We have one nominee for an initial 3-year term in the Ontario position on the Nominations Committee. We have one nominee for an initial 3-year term in the Prince Edward Island position on the Nominations Committee. One nominee for an initial 3-year term in the Saskatchewan position on the Nominations Committee. We have one incumbent nominee for a second 3-year term in the affiliate position on the Nominations Committee. One nominee for a third 1-year term in the resident position on the Nominations Committee. We have one nominee for an initial 1-year term on the student position on the Nominations Committee. As noted in the Nominations Committee report, any unfilled vacancies under the purview of the Board of Directors, the Board can fill committee seats for a full term and the Board seats on an interim basis until the next AGM. So before we proceed to the approval vote, I invite any related questions. I'll ask Dr. Bouchard to assist me in moderating the Q&A and Dr. MacDonald to assist in answering any questions on this year's leadership selection process. Over to you, Dr. Bouchard.
Thank you very much, Dr. Ross. I'm just checking to see if we do indeed have any questions. Okay, I believe the Q&A has just opened up, so we'll give our members a moment, or our delegates rather, a moment to type in any questions that they may have. There are none so far. In addition to any questions about the selection process, if anyone has questions about the meeting process, or if you'd ever like to make a motion, please know that we are here to help you with that. If you want to describe what you would like to do, we can help facilitate. You don't need to know anything about Robert's rules. I've been prompted to provide more opossum facts. Thank you. So one interesting fact about opossums and why I quite like them is that they eat ticks. And I practice at a children's hospital in Ottawa where, unfortunately, we've really seen a resurgence in Lyme disease over the past few years. So I would love to see more possums out in the wilderness. I know that no good has ever come from human beings interfering with nature's ecology, but I do wonder if we could have some sort of possum tick program. So I'm hoping my public health colleagues can weigh in on that.
Start bringing them into the emergency department.
Bringing them into the emergency department. Unfortunately, by then, the ticks have typically already done their damage. But I think it would be great for staff wellness. It's an idea. Okay. I've now been informed that no cues have come in, so I think that this is my cue that we will be concluding our question and answer session. If there are any last minute questions, you've got about 10 seconds. Okay, let's move on to the motion. So you should shortly see projected motion GC-1, which I will now read aloud. CMA General Council delegates approve en bloc all leadership positions presented in the Nominations Committee report as projected during the meeting of General Council delegates on May 29, 2026. This motion is moved by Dr. Kathleen Ross. Since it comes directly from the committee, we actually do not need a seconder for this motion. We will now review the voting process for those General Council delegates who did not attend the previous portions of this meeting. When the vote is called, a pop-up window will appear on your screen as shown on the slide. General Council delegates will have 1 minute to vote. A timer will count down the remaining time once the vote is opened. You can change your vote during the allotted time, but once you hit submit, that vote will count as final. If you are not registered as a General Council delegate, you won't be able to vote. The event site will just not produce a ballot for you. Let me check to see if we are ready to launch our vote. I've been informed we are ready. This motion does require a simple majority to pass. If the slate of nominees is not confirmed under CMA bylaws, any positions that are not approved will become vacancies that can be filled by the Board of Directors. You have 1 minute. Please vote on motion GC-1 now. There's about 30 seconds remaining. 30 seconds remaining for those voting. Ten seconds left, not even. Okay, the voting period has now ended. Please stand by while I check to see if the results have come in. Okay, please project the results to the Assembly. When it comes to motion GC-1, the approval of candidates en bloc for leadership positions, we have 67 for and 3 against. The motion is carried. I invite you to welcome and applaud virtually the President-elect, the Board Directors, AGM Vice Chair, and committee nominees who have been confirmed today. Congratulations to all. Dr. Ross will now give a brief announcement.
Thank you so much, Dr. Bouchard. At the end of August, the CMA will be issuing its next call for applications for leadership vacancies to be presented to General Council in June 2027. The call will outline the roles, time commitments, and timelines, and I encourage you to consider putting your name forward. The President-elect election will be in Nova Scotia this fall. In mid-June, we will issue a call for interest. Members from Nova Scotia may apply by September 7th. Over to you, Dr. Bouchard.
Thank you, Dr. Ross. I just want to reiterate my comments from earlier. The application process opens in June, but the deadline is September 7th, so you've got even more time. But thank you very much, Dr. Ross, for your service this year and all the years prior. I would like to thank all the speakers and participants, as well as the tremendous CMA staff for their work. Merci aux candidates et aux candidats qui se
Thanks
sont
to the
présentés.
candidates who ran, and congratulations to those who were elected.
Receive a meeting evaluation. Your feedback is really important to us. It's quite interesting to read, truly, and we do encourage you to take a few minutes to complete it. There being no further business, I now declare the 2026 meeting of the General Council delegates adjourned. Thank you. Bonne journée.
Before everyone leaves, I just want to, on behalf